Welcome back to my channel, everyone. My sincere apologies for the delayed upload of this video. This video covers the support available for international healthcare professionals wishing to work in Australia for the first time. Let's get into it. Support for international healthcare professionals. The Victorian Department of Health is continuing to support healthcare professionals who are currently located overseas and are seeking to work in health services across metropolitan Melbourne and regional Victoria. Available support. The Department of Health supports international and returning Australian healthcare workers who have secured a role in Victorian health services to have a clear and supported pathway into the state. Once healthcare workers have secured a position in the Victorian Health Service, the department can support applications to obtain registration to practice, support applications for relevant visas and border exemptions, help healthcare workers and their immediate family plan to travel to Australia and meet quarantine and other requirements. International Travel Allowance. From 1st November 2021 until 31st March 2022, the first 1,000 workers who arrive and commence employment with the Victorian Health Service are eligible for the International Travel Allowance, which is a relocation payment of up to $2,000. Eligibility. Who is eligible? This program is an opportunity for health professionals who are Australian citizens or residents or international candidates who have secured a job with a Victorian Health Service, can access Australian registration for their profession, can obtain an appropriate visa and a COVID-19 border exemption if required, are fully vaccinated for COVID-19, can be ready to travel to Australia before the end of March 2022. Who is not eligible for the International Travel Allowance? The wider focus of the allowance is on Victorian public health services to restore these services to full operational capacity following the impact of the COVID-19 pandemic. The following workers or arrangements are not eligible for the allowance: workers who are not direct employees of health services casual bank staff, workers in administrative, office management, communication, clerical, research, and other functions that are not patient-facing, workers that are employed through third-party agencies or who are otherwise not directly employed. How to apply? Discussions should occur as part of the recruitment process regarding eligibility. The allowance will be provided to new employees by their health service in accordance with existing health service payroll processes, whether those be monthly or fortnightly. Health services are required to identify these payments within their systems. Some services may require workers or managers to complete documentation to claim for this allowance. So what they're simply saying is, during your recruitment process, discuss with your manager and find out if you are among the first 1,000 workers so that you can qualify for the $2,000. Secondly, when the allowance is paid to you, it will not be paid to you as a lump sum. It will be paid to you depending on the arrangement you have with your employer, whether you will be paid monthly or fortnightly, and it will also be paid to you in addition to your salary. So you first have to arrive in Australia and commence employment to receive this $2,000 travel allowance. In some circumstances, depending on your profession, you are required to request for this payment as a claim. Your manager will provide the documentation for you to complete and lodge the claim for the travel allowance. I hope that's clear. Moving right along, vaccination for COVID-19. You will need proof of vaccination for COVID-19 to enter Australia. The Australian Technical Advisory Group on Immunisation has provided advice on a range of COVID vaccines that are considered valid in Australia. COVID-19 vaccines that are currently registered and available for use in Australia: Pfizer, Moderna, and AstraZeneca. For further information regarding recognition of other vaccines, please refer to this advice. I will link this below in the description box. Moving right along, visa and priority migration skilled occupation list. If you are an Australian citizen who is returning home, you do not require an additional visa. If you are an international resident who will need to apply for a visa once you have secured employment with a Victorian Public Health Service, in order to access travel support through this program, your occupation must be listed on this priority migration skilled occupation list. That is a tongue twister. Currently, for health professionals, this includes the following professions: medical laboratory scientist, hospital pharmacist, industrial pharmacist, retail pharmacist, orthotist or prosthetist, general practitioner, resident medical officer, psychiatrist, medical practitioners, MEC, midwife, registered nurse in aged care, registered nurse critical care and emergency, registered nurse medical, registered nurse mental health, registered nurse perioperative, registered nurse NEC, and social worker. I'd like to go and give you a definition for the registered nurse NEC. So what that means is that your position has not been categorized. So you may be qualified registered nurse, but it has not been mentioned here whether you work in aged care or critical care or mental health. You could be working with children or something else. So what that NEC means is not elsewhere classified. So it means you're still qualified to apply for a job with the Victorian Health Services. I will provide this link in the description bar below for you to peruse and see further information on the priority migration skilled occupation list in detail, because it includes other occupations. Moving right along, registration as a health practitioner in Australia. For most healthcare professionals, working in Australia requires registration under the National Registration and Accreditation Scheme. This is to ensure the community has access to a safe healthcare workforce and receive high-quality healthcare services. The process for gaining registration as a health practitioner in Australia is overseen by the relevant national boards of Australia, which is supported in its function by the Australian Health Practitioner Regulation Agency, APRA. This is their website, and it just gives you more information on how to register, how to renew your registration, how to find out if you are a qualified practitioner in Australia, and a lot of other information. Please visit the website. I will link it down below. COVID-19 border exemptions. Australia's borders are currently open and entry to Australia is restricted to help prevent the spread of COVID-19. Travel to Australia is currently only available if you are exempt or you have been granted an individual exemption. In our experience, health professionals traveling to Australia under this program have been able to access an exemption because they have critical skills in occupations listed on the Priority Migration Skilled Occupation List. For further information on border exemptions, please visit the Australian Government Travel Restrictions and Exceptions website. So this just shows you detailed information on travel restrictions and exemptions. I will link it down below. So guys, for now, I will end this video here and I will continue on another video. Please keep following my videos because the next one will be a continuation. Thank you for watching. I hope you subscribe to my channel and you find this information helpful. Kindly share it with your friends, your contacts, your family, and anyone who you feel can benefit from this information. It is not too late to apply. Please give it a go. You never know the outcome. Thank you for watching. I'll catch you in the next one.